Cardiac catheterization has really evolved over the last 20 to 30 years. We have great technology in terms of balloons and stents, and our equipment has gotten a lot smaller. We've also investigated other access points because traditionally all the access was through the femoral artery, which is a large artery in people's groin. But more and more we're doing coronary angiograms and angioplasty through the radial artery, which is in people's wrists. It really cuts down on bleeding. It also improves patient satisfaction and is less uncomfortable than having a large catheter in the artery in the groin. The procedure is fairly straightforward. We put a small catheter, again, usually in the wrist. This is done in a room that's called a cath lab, which is kind of like a glorified surgical suite. There's a table and an x-ray camera. And the gist of the procedure is that we inject dye or contrast into the heart arteries, and using x-rays we're actually able to image those arteries in a movie-like fashion. So once we get the catheter in the wrist or in the groin, we use longer catheters which actually engage the coronary arteries. And again, we can inject dye in there and take pictures. That's kind of the diagnostic portion of the test, where we again get the lay of the land, get the anatomy and figure out where blockages are, if people have blockages, and again then devise strategies in terms of how to fix them.